Here we go again, dear friends of United Talk Updates. Let's talk about the injuries of Matheus Cunha and Mason Mount. Manchester United have been hit with a compact cluster of absences heading into a busy spell of Premier League fixtures. Matheus Cunha, who completed a high-profile transfer to Manchester United in the summer, was forced off during United's 3-2 win over Burnley prior to the international break. Reports indicate the Brazilian left the field with what the club described privately as a hamstring issue, subsequently withdrawing from Brazil squad commitments for the break as a precaution, while the club undertook scans and monitored his recovery. The earliest media coverage described the problem as hamstring-related and flagged that Cunha had not returned to training immediately after the break. The medical reality of hamstring injuries. Hamstring strains are among football's most common soft tissue problems. They range from minor grade 1 tears, short stretches of damaged fibres that often heal within 1 to 3 weeks with conservative treatment, to grade 2 partial tears, a few weeks to a couple of months, and the more serious grade 3 ruptures that typically require surgery and longer rehabilitation. Acute hamstring injuries usually happen during high-speed running, sprinting, or sudden acceleration and deceleration. Exactly the type of dynamic actions a forward like Cunha performs dozens of times in a match. Early signs that clubs monitor include pain on contraction, weakness on resisted testing, and a change in sprint mechanics. Standard practice is to scan usually MRI to grade the tear and to rule out associated injuries. Reported severity and timeline. Publicly available reports do not provide an explicit grade from scans, which is common. Clubs rarely release that depth of medical detail. The coverage that has surfaced classifies Cunha's issue as a hamstring injury that kept him out of training during the subsequent days and led to withdrawal from international duty. That suggests the club opted for caution. When the timeline is unclear, clubs prefer to avoid rushing a recently signed forward back into action because a premature return risks re-injury. Early conservative management, rest from high-intensity sprinting, graduated loading, physiotherapy, and anti-inflammatory strategies if appropriate, is the usual route. Return to train and return to play criteria, objective tests, symmetry in strength and power, sprint times compared with baseline, and sport-specific conditioning. Many elite clubs require players to complete a progressive on-field protocol with contact before match clearance. Tactical and squad impact, Cunha's absence removes a newly acquired attacking option and places pressure on the manager to accelerate the integration of other attackers or adjust formation, either by deploying other forwards, moving a wide player centrally, or using a different pressing template. The club may also look to manage his minutes on return to reduce recurrence risk, which can slightly blunt the immediate utility of the signing, but is a prudent long-term strategy. Mason Mount, a central figure in United's midfield plans, was also reported to have picked up a hamstring problem during the same Burnley match that saw Cunha's issue surface. Media coverage indicated Mount withdrew from international duty and was missing from early training after the break, prompting speculation that the issue was similar in type, though the context of his role, a hard-working box-to-box midfielder with heavy aerobic and sprint demands, changes the rehabilitation emphasis. The initial reports treated Mount's hamstring complaint as one of the cluster of absences that left United light in midfield heading into the next fixtures. United's sports science team will be measuring objective markers, jump height, isokinetic testing if available, sprint times, and GPS training loads to clear Mount, not simply subjective symptom resolution. The emphasis will be quality of availability rather than speed of return. The club has learned that repeated short returns followed by re-injury is a far worse outcome for both player welfare and team performance. For the players, Matheus Cunha. As a new signing, his early injury is inconvenient but not catastrophic, provided the club manages him carefully. The bigger risk is if initial rehab is rushed, a re-injury could derail his early momentum and adaptation to the Manchester United system. If handled conservatively, Cunha should be able to re-establish himself once at full fitness. ManUnews.com. Mason Mount. His role demands high match fitness and tactical cohesion. A gradual return with emphasis on repeated high-intensity work and minutes management is essential. Mount's value lies in both his technical play and work rate. Short-term absence may be felt in pressing phases. Thanks for watching.